KLTV sound check, KLTV sound check.
All right, good morning and welcome to our Tuesday morning meeting. We have Scott from from Father's House here this morning for our invocation.
Good morning, everybody. Chaplain Russ wanted me to say hi to everybody. And I just thank you for this time today. And I thank you, Lord, for this gathering and the community members involved. Bless the commissioners with unity and have all the issues that need to be brought forth, that may result in prosperity and blessing over this county. Thank you. Amen.
Amen. Scott, thank you, sir. If you'll please join me for the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Okay. Commissioner Dahl is excused today. He's not here, so you guys have to put up with me. I would entertain a motion to approve the minutes.
I move approval of the minutes.
Okay, we have a motion for approval of minutes. Any questions, concerns, or conversations? No? Okay, we'll move to vote. Those in favor? Aye.
Aye.
Okay, motion passes. All right. On to consent agenda. Call for bids. We have call for bids for Cowlitz County Headquarters Landfill 2025 Gas Collection and Control System Expansion Project scheduled for August 26th, 2025 at 1:30 p.m. Request for proposals for qualified firearm range operators to manage and operate the Cowlitz Public Shooting Range scheduled for September 18th. On that particular one, the current contract that we have with the
Cowlitz Game and Anglers.
Yeah, Cowlitz Game and Anglers will be expiring, and we're just wanting to see what is, if there's any interest on the public market, and see if there's anything that we can do, if anybody's interested in the private sector to operate that for us. Agreements, contracts, and bid awards. Interagency agreement with the Washington State Department of Agriculture to control knotweed species infestations located within the riparian corridors of Cowlitz County. An interagency agreement with the U.S. Forest Service, Gifford-Pinchot National Forest, to treat noxious weeds within the Mount St. Helens Volcanic Monument and the Gifford-Pinchot National Forest, Cowlitz County, and across the jurisdictional boundaries. We've got a purchase of CrowdStrike Falcon complete under the auspices of the Omnia Partners contract for proactive threat hunting and integrated threat intelligence. The total amount on that particular one is $84,110.88. Board correspondence. We have an affidavit, letters and notices. We have an affidavit of posting resume for the month of June 2025. Federal Regulatory Commission notice dated July 23rd regarding an order amending license to modify the Yale Saddle Dam and approving Exhibit A and F. Letter dated 7/21/25 from the State of Washington Department of Fish and Wildlife regarding a notice of possible property acquisition in Cowlitz County. Excuse me. We have vouchers in the amount of $3,035,386.75. And that is our consent agenda. Any questions or concerns?
Morning, Commissioners.
Morning.
Could you just give a little explanation on item number 5, this CrowdStrike Falcon complete?
Yes, that is a software company that helps us with any malware or issues that we may have in the IT department. We contracted with them when we had the suspicious activity a while ago, and they were one of the carriers that we used to help us solve that problem. And they've already got we've already integrated a lot of their services and things that they offer into our IT department. So this is actually an upgrade to our current system that we have. The current system that we have is somewhat antiquated and outdated. And this is going to help us a lot, quite a bit, step up our security in our IT.
It's kind of like virus protection and malware protection, and hopefully keep us away from ransomware issues.
Very good. By looking at it, I thought it was some endangered species, and of course it is. We would like to make the viruses and those hackers endangered species, so thank you.
You bet.
You make a fortune if you figure out how to do that.
Yeah. Anything else?
I move approval of the consent agenda.
Okay, we have a motion to approve the consent agenda as presented by staff. Any other questions or concerns? See if there's anybody online. Doesn't look like it. Okay, we will move to vote. All in favor?
Aye.
Aye. Okay, motion passes. As far as we have chairman updates, we have a pretty light agenda today, guys. Not much going on, but upcoming events we do have. Let's see, Monday, August 18th, we have at 11 a.m. we have the Janus House in here. Wednesday, the 20th, at 2:30, we have a sheriff's replacement fund conversation going on. Tuesday, the 26th at 10, we have the Board of Health. And September 9th, we have Southwest Washington Workforce in. So, okay, any citizen comments?
Yes, good morning. Any updates on anything to do with mental health and the people that came in here and talked to us a couple of weeks ago?
Yes, I actually had the opportunity to visit with them last week prior to me leaving for the risk pool. We went and visited the hospital there that's for sale at the end of Broadway. They really like that piece of property and the hospital. After meeting with them, we met for several hours after that and conversed, and they are very interested in that piece of property. One of the things that they feel that they're going to be able to do is utilize it as a wraparound, entire, one-stop shop for mental health, substance abuse, long-term rehab. So we had some good conversation. I have some things that I'm working on this next 2 weeks to get back to them. I'm rescheduled to meet with them on the 18th of this month. And it sounds like there's going to be some hurdles that we're going to have to overcome, but they are very interested in moving forward with that location, along with the location at the old Charlie's. That's also moving forward.
Is can I assume that because the old Charlie's is somewhat simpler, that's going to be the first one? And then, of course, long-term working on the comprehensive hospital?
Correct. To my understanding, the Charlie's, the entity that is working on the Charlie's building, their Emerald City is one company, and then the company that's doing the 16 bed situation at Charlie's is a different one, but they're working together on that project. Emerald City is the one that's interested in the hospital. So they're two companies, two different projects. Yeah. So, but yes, Charlie's will probably go through first, just due to the fact that we're dealing with Peace Health on that particular property, whether it's sold or whatever needs to be done there first. Charlie's has already been acquired and ready to go.
What is I kind of missed this somewhere along the line. What is the category of care for the Charlie site?
I believe that one is for the True Blood people that are at Eastern and Western state hospitals that are going to have to be moved out of those.
Oh, okay.
Hospitals because of the state situation.
And those will be Cowlitz County people coming back?
Yes, that's what the intent was.
At first, the first ones coming back will be Cowlitz County people. After the Cowlitz County people are all gone, then obviously they're going to be people from other locations.
Yeah, because I remember probably 3, maybe 4 months ago, I talked to Marin, and at that time we had 19 Cowlitz County residents in Western. So if this is 16 beds, obviously comparable numbers, which would tell me that ought to be pretty much Cowlitz County people.
Yeah.
Okay.
Yeah. The issue that the state's having right now, they're being fined every day that they're out of compliance. They have nowhere to send these people. And that's why they're being fined, because they're still holding people within those hospitals. And that's what this company saw the opportunity to say, hey, the state has to move them somewhere. Let's utilize this opportunity to bring them here. So, but that's a different issue that's being resolved than what's taking place, what we're hoping for at the end of at the hospital at the end of Broadway. That the hospital at the end of Broadway is mental health, long-term, substance abuse rehab. We're looking at possibly, if we're able to, implementing drug court into that so that they handle the drug court portion of it, and drug court's no longer funded by taxes. So we're working with them if we can make this work to where that is truly you go there for all the needs, and homeless also. Because the majority of the homeless people that we see on the streets, there's substance abuse or mental health issues, and they're going to be able to facilitate that long-term in that facility is the goal.
And Charlie's site will remain viable even when the hospital comes on.
Yes, because they're two different
Yeah,
entities.
okay.
Yeah.
All righty. We'll keep pressing on. This is the
Yeah.
biggest issue in the county.
Yeah, we're working, moving forward on what we can to make that happen.
As an awareness on our county roads, the crews have done a lot of chip sealing this summer, and a lot of it is still out there waiting 3-4 weeks later for line painting. So that creates a hazard and a danger, and especially as the weather and the lights come on. So it would be, at least if you check in and see what's the plan for getting painting done, it's hard to see and on those roads.
Susan is here, and she looks like she might be able to address that for us.
Good morning, Susan Eugenius, County Engineer. So our striping program is underway, and we are working through our list, and we're hoping to be done early September.
How soon after chip seal gets put down can they stripe?
A week and a half. So it's rough because you have to get it in and then you have to sweep it. So it takes a while before you can get out there, and then it's the timing. But they are in the process, and we're trying to hit all of our, so on our striping list this year is all our arterials or collectors, anything that was chip sealed or overlaid will be done by our contract. And we're concentrating on the roads that were overlaid and chip sealed to try and get those done before September, in case weather sets in.
On some roads, I see these little yellow tabs, like delineators down the middle of the road. Are we doing that? Do we do that?
We do it on some of our roads, and I'd have to talk to the road supervisor on how they pick which roads that they put those out on. They generally refer to them as stick and stomps because they're sticky on one side and you stomp on it and down it goes.
Okay.
The interesting observation on those little reflector tabs going down is that they put, at least on the road I have in my area, they put them down, and then when they did the chip seal, they sprayed them with the black. So now you can't, there's no reflection, you can't see them. So just a technicality on the use and efficiency of those.
Yeah. Is there a chronological order do we wait until all the roads are chip sealed in the county before we go back and repaint them, or do we chip seal and then we have one crew doing one thing and another doing?
So we contract out for striping. So it's just a matter of when our striping program started, and it just started recently, and they tend to go through areas. So I know they were working in South County last week, and then they tend to work their way in whatever direction the striper wants to go. So sometimes they bounce around because of weather, especially South County, especially the Woodland Bottoms can be foggy and windy, which hinders the application of the paint. So they try and hit areas as efficiently as they can.
I do also want to just give a little report on our risk pool conference that I attended last week. Our risk pool is looking at making some changes with regards to our carriers because of the legislative environment that we're in the state of Washington. We have lost a lot of carriers in the state of Washington that are no longer willing to do business in the state. And so our risk pool, it's called an insurance tower, And the way that it works is the risk pool is responsible. 4 years ago, the risk pool was responsible for the first $175,000 of any individual claim. And then from 175,000 to 3 million, a different insurance carrier would pick that up. And then from 3 million to 6 million, a different insurance carrier would pick that up on any individual claim. Well, our risk pool, self-insured retention now is up to 3 million. So the risk pool is responsible for the first 3 million of any individual case now. And then from 3 million to 5 million is a different insurance carrier. And we could not find, there was no insurance carrier that was willing to pick up the 5 to 8 million category. So the risk pool had to pick that up. So the environment that we're in the state right now with domestic carriers is pretty rough. So they're now looking internationally. They spent a couple of days in London looking for carriers to pick up these slots in the insurance tower because there's no domestic carriers that are willing to do business in Washington. There's a lot of things contributing to that. We have the number of claims that are being filed in the state has gone up dramatically in the last 4 years, and the size of the awards that are given based on these claims has also gone up. On top of that, we have the sexual assault and molestation statute of limitations that has been eliminated, and the number of cases that are now being filed in the state of Washington going back to 1984 they don't stop coming in. The issue that they're having right now is they litigated the first 4 that they got. The awards on those 4 were all over $3 million. And the other 24 that they got, they settled because they don't know where this is going to stop. And so we're in a situation to where the justice system with attorneys and judges are awarding awards for just saying you were assaulted because you can't defend it. You can't fight it. It's not a matter of proving that it did happen in this situation. It's a matter of proving that it didn't happen. And so the amount of money that is going out the door is astronomical. And so the state itself, I believe, Steve, do you remember what Senator Wilson told us, the tort claim? The state's budget's like 78 billion and the tort claims are 113.
It's in outer
The
space.
number of tort claims that the state has against it currently far exceed by the billions that the amount of what our annual budget is for the state. So what the risk pool is doing is they are looking to hire lobbyists at the state level and at the federal level, because the only way this is going to change is through a legislative process. I mean, it's to the point now to where we were told that we have hedge fund managers that are giving money to law firms in the amount of $250,000 to $500,000 a month to advertise to get people to come to help open a claim, and then the hedge fund will receive a portion of the award that is given. So it's no longer about justice. One of the other things that's happening is because this has opened it up, they're now looking to, this is more about punitive damages than making a person whole based on something that happened to them. It's more about making the companies, making the county, the state pay for and punish them for what took place in 1984, whenever it was that it took place. So it's a frustrating situation that we're in. The only thing that's going to change it is a change in legislation, because the current environment is allowing this to continue.
Well, it's hard to defend a claim from 35 years ago when somebody in the jail supposedly did something wrong, and now you point a finger at them and they're dead and gone. They're not even there to ask them or to talk to them. Most of those records are no longer in existence because they've been disposed of. So there's just a nightmare of legal proliferation, ambulance chasers, if you will, that are now being rewarded for being able to just get a claim filed. So anyway, go ahead, Ron.
Well, another piece of that is the state insurance commissioner. Is that insurance companies that I know that are trying to do a good business were not in favor of this commissioner being in the position again. And the commissioner should be working for us. And the citizens that have legitimate claims are being raked over the coals through all of the, harassed in essence for the other forms. So as representing us and Commissioners of Insurance, I would highly encourage you to write a letter to the state commissioner to get his act in order and representing us, the citizens, on insurance for the state.
Yeah, that's something that we could do individually as a county. I agree, Ron. Wasac is involved in that right now with trying to get, put some pressure on legislators and on the insurance commissioner also. The problem with it it's obviously a huge problem, but what
It's
it does is
political.
we're now looking at, we're gonna have to increase our insurance premiums to the risk pool again to the tune of 20 to 25%. And that's across the state. Everybody that's in that risk pool is gonna have to increase their premiums. And this is all money that comes out of the taxpayers' pockets, one way or another. And so it is, I mean, on the way from Walla Walla to here, I heard 2 commercials on the radio. Were you assaulted by such and such a church? If so, call this number. So, and it's all over social media. To Commissioner Farrell's point, this is something that is being propagated and allowed to continue. And it can't last for very long under the circumstances. Something's going to have to change. And so there's a movement within the counties. One of the things that we're looking at doing, we're not looking at doing this yet, but a lot of counties are looking at consolidating their jail services because there's insurance carriers that have now said, if you don't have health monitoring systems on your inmates, we're not going to cover you for that. We're going to start to see more and more to where it's just going to be more cost out of our pockets. And so the counties are being forced to look at different options and ways to save money. So as opposed to having 33 different jails across the state, all of them having these health monitoring systems in all their jails, counties are looking at consolidating 2 to 3 counties per jail if they have the capacity to do that. And that's going to create another issue, public safety. If they don't have the capacity to take people in, what are we going to do with them? Where are they going to go? It's just, it's a big problem that we have in our state. And quite honestly, I may be overstating this, but it's what happens when you have one party rule for 20 to 25 years and there's no checks and balances and things run amok. And that's where we're at right now.
Right. And with all those issues you just brought up, we don't see any publicity coming out of our state insurance commissioner kind of heads up and pointing out those. And the secondly is that the insurance companies that withdrew from the state at the beginning of this year, house insurance and things like that, hurt us all. And then not able to get insurance across the state borders. There's a whole lot of regulations that are basically, and I'll just put it this way, screwing us over.
Mm-hmm. It's an interesting statistic that they gave us is that this is the first time in history where a single claimant, filed a case. The award was over $100 million to the individual. It wasn't a class action lawsuit and it wasn't a corporation or entity. It was 2 individual cases, each awarded over $100 million. And we're seeing things like they're awarding one of the new common claims that's being filed against is trees. Trees are falling because we live in a state where people plant trees. We have trees everywhere. Like the number of tree claims that have been filed in the last 12 months have gone up, and what they're paying on those, because in one situation it was a life-altering event that took place where a tree limb fell on an elderly lady. The awards that they're giving are they're huge awards. They've never seen numbers like this before. So we're being proactive on our end within the risk pool and within Wasac, and we're going to do what we can as commissioners to put pressure on them. But something's going to have to give. I mean, if there is any good side to it, it's forcing us to look at things and ways to get creative with regards to consolidating and trying to be more efficient. But we can't do that without at some point creating security and safety issues with people.
WASAC is Washington State Association of Counties
Counties, yeah.
that we belong to.
Right, right. And again, we also get jabbed on the auto insurance. This portion of a third of our policy goes for paying for uninsured motorists for us that are insured. And so we need to keep reinforcing our police authorities that when they stop people, check them for their insurance.
Yeah, it's gonna impact us in the form of, we're gonna have to have a higher deductible. And we're gonna have our premiums increased for the risk pool. There were counties that thought maybe they could do better going outside the risk pool, and when they looked at the premiums that they were gonna have to pay on their own, they're like, we can't go anywhere. Utilizing the risk pool is gonna be very advantageous for us moving forward. The issues that they're having are I wanna say that it was over 5 years ago, we had 4 insurers that were able to cover our insurance tower. We have 8 insurers because the insurers are leaving and they're reducing their liability coverage. So they're not covering for as much, and we're having to get more insurers because they're just not willing to cover it.
Right, and the points that you are making representing us on the insurance pool are the same issues that we're facing on our private insurance with having to raise our deductibles, et cetera, to try to make ends meet.
Yeah.
And be insured. Thank you.
Yeah.
Hi, a couple of questions. On Wednesday, the August 20th, you have a sheriff replacement fund workshop. I was just curious what the sheriff replacement fund is. Should Sheriff Thurman be worried? Yeah, I was like, what is that?
Yeah, I don't know what that is, but I don't think that it's a fund that was created to replace our sheriff.
Yeah, well, just an interesting name to it. My other question about the possible facility at the old hospital. Do you have a sense of what role the county will have in that? Like, will Cowlitz County be providing financial assistance or what? Yeah, just what?
At this point, I can tell you that we're gonna do what we can to help them. I don't know that we are in a position to help them financially. But having said that, I have a conference that I'm gonna be at. I call it a conference, but it's just gonna be a stakeholder meeting within the Great Rivers Behavioral Health Organization at the end of this month with all of the county commissioners involved in that. And we're gonna have a conversation on the future of that organization and the services that it provides, because there's gonna be crossover services.
Sure.
That organization provides and that Emerald City provides. We are not planning on helping fund a private sector for-profit organization when it comes to money. But anything that we can do to help them with the hospital, the permitting process, whatever we can do to help, we're gonna help them in any way.
Yeah, no, that makes sense. I agree with that. If that role changes from the county's perspective, would there be a way, or maybe even if it doesn't change, to somehow reserve some of those beds for Cowlitz County, the police arrest somebody who needs that kind of help? Because there's such a need for that I feel like it's just going to be a magnet. It's going to be filled, and there's going to be no room left for the people locally who need help. So if we're sort of housing it here, like, is there a way to ensure that our people are going to be able to be admitted when needed?
So the hospital situation is different than Charlie's.
Yeah, I'm not talking about Charlie's.
Okay.
I know that's a
But
totally
as far
separate.
as the referral process goes, so those people at the Charlie's location are going to be referred by the state hospitals.
Yeah,
The
I'm not
people at the
talking about
hospital at the
Charlie's.
end
Yeah.
of Broadway will be referred by our local services and/or elsewhere. So we're going to have first dibs because it's going to be our service providers that are referring people to that hospital. We'll have first dibs on that. That's where the meeting with the Great Rivers Behavioral Health organization is going to be, because this is going to be a regional center that they're looking at.
Yeah.
So anybody within that GRBO will be able to refer their citizens to that. The way that it's looking like it's going to be structured is each individual floor will have a different service
Sure.
and a different entity is preliminarily what we're thinking it's going to look like. So it's not a matter of, we can't look at it like there's 360 beds in this hospital. There's 360 beds available. for
Right,
instance.
right,
That's
right, right.
not-
I know there's different levels of care and different needs and things. No, yeah,
But I would say just due to the fact that the people that are going to be, the patients that will be in that hospital are going to be referred by some local service provider. They're going to be, the majority of them will be Cowlitz County residents.
will they be accepting patients from King County, from Clark County? So potentially it could fill up with sort of out of area people.
I mean,
Like,
potentially, I guess it could. But with the need that we have in our county, you know, I don't know that King County service providers will refer people to this hospital right off the bat.
yeah, yeah. Okay, I just want to make sure there's space for our local folks to get help and not have it be filled up. And another thing I would also make sure, and I don't even know how you'd prevent this, is that, you know, the Clark County, whomever works with that population, Clark County doesn't just start dropping people off in Cowlitz County so that they can get into, you know, those services. I don't know how you'd prevent that, but just, I don't know. You guys are clever. Maybe you have a way to do it, but
We haven't had that conversation,
Yeah.
but I did speak with both the CFO and with Zandra, the lady that was here and presented to us, and let them know that our priority is Cowlitz County citizens.
Yeah.
You know,
yeah,
granted, if we don't help them financially and it's a private sector for
It's-
profit, they're going to do what they're going to do.
totally get that. Totally get. That's why I was asking what the role of the county was going to be, because if there was a financial stake by the county, then absolutely this many beds needs to be reserved for Cowlitz County. Even if they're empty for a little bit, they're open until Cowlitz County citizens need them in my perspective. But if it's a private, I totally understand. Like that's their rodeo then.
It's where it really is about developing a relationship with them because of the crossover with the services that are provided by our local service providers. We talked at length about the possibility of some of these service providers going away.
Yeah.
Because this organization could replace what they're doing.
That would be awesome.
But they could also bring them and hire those people that are working at those service
Absolutely.
providers.
Yeah. Yeah.
So we looked, these are all preliminary numbers.
Yeah.
But when we sat down last week and looked at what we're wanting to do at each level of the hospital with the different care that's provided, we're talking upwards of 260 employees to be able to run that thing 24/7.
Nice, nice. Good. Yeah, I know it's preliminary and it's such a need. I just want to make sure that our folks are not overrun by out of county or out of area from the Great Rivers behavioral area. So
I can tell you that this is, if we can get this to go through, it's the first of its kind. There's
Oh.
nothing like it anywhere in Oregon or Washington.
cool.
Currently, Emerald City, I did a little research on them. They got Lakewood City to approve a youth facility.
Mhm.
So they're working on building a youth facility up north. So this is something that they do. They know how to do it.
Yeah.
And in my conversations with them, I told them, I said, look, we want to make sure that you guys are profitable, that you're making money, because if
Totally.
not,
Yeah.
you're going to come and go. We want
Yeah.
to make sure that you're here for the long term.
For sure.
And they said, if we can't make money, we won't do it.
Yeah. Oh, yeah. I mean, they're business, which awesome, man. Have private industry take care of it. That would be the best option. But yeah, maybe once it's built, maybe just don't advertise. No advertisement. So nobody. No. Okay. Thank you.
Yeah. Anybody else? No? Okay. Thanks, guys. We'll adjourn. Looks like there should be more.